It is the deadliest form of skin cancer. Melanoma is diagnosed about 40,000 times in the U.S. each year. Nearly half of those cases are fatal. Well, now you'll be spending more time out in the weather. We just saw Keith's forecast. Looks great for the weekend. So it's crucial to protect your skin, and certainly your children's skin. Joining us with what you need to know about melanoma, including a new device that detects the cancer earlier than first thought of, dermatologist Dr. Charles Crutchfield. Doctor, good to have you here.
Thanks for having me.
First of all, let's talk about what we're looking for with moles. Not so much the moles maybe we've had for years, but new moles that might pop up. And then what should we look for with those moles?
Well, most dermatologists recommend paying attention to what they call the ABCDs. The four letters stand for asymmetry. If you can't fold the mole back on itself, that's asymmetric. B stands for the border. If it's kind of rough or jagged or uneven. C stands for color, color variation within the mole. I think we'll see a good picture of that in a little while. It shows different colors within it. And then D stands for diameter, bigger than 6 millimeters, and that's about the size of a pencil eraser.
These are all indications it might be cancerous.
Correct. Some people even say E, E for evolution or changing or elevated, raised up.
Let's take a look. We have some pictures to show what different type of moles we're talking about. This gentleman has one that looks like on his back there.
Yeah, it's on the side of the neck, and this actually turned out to be a melanoma. But if you look at the lesion, you see that it's irregular in shape. It's asymmetric. The border is irregular. If you get a close-up on it, there's color variation within it, and it's certainly bigger than 6 millimeters. So it violates all four rules. And
that's a pretty good size mole. Now, ooh, boy, that obviously looks like trouble right there.
That does. And the patient presented for a changing mole on the back of the neck. He had come in because his wife had noticed that and wanted me to take a look at it. And so when he leaned forward, I looked at the back of his neck and moved the hair aside. I realized this too looked like a very troublesome and worrisome lesion. This turned out to be melanoma.
It's fairly large.
It's fairly large, and you can see with all these, you can see the color variation, the size. This one has a nodule in the center that's elevated and evolving.
Wow. And are all these probably the direct result of sunlight and getting too much sun without maybe a sunscreen?
Yep, a lot of people think it's they're two different things. Genetic factors are involved, and then also chronic sun exposure. People that have worked on road crews, lifeguards, worked outside all the time, park rangers, roofing crews, things like that.
And so that's one of those things that you want to certainly check, especially your exposed areas to the sun, that is, to look for any changes that you might have, or in this case, if you have a spouse or a friend that might notice something you don't.
Sure, and I think it's always good for everybody to have at least one comprehensive skin exam from a board-certified dermatologist. The rule that I go by is see spot change, see a dermatologist.
Simple as that. Okay, now you have certainly a new instrument, fairly new anyway, that will help detect those moles and show us what we're talking about here.
Well, this is called a dermatoscope and also dermalite. These are tools that allow us to take a closer look at moles right inside the office.
Let's see, where's a mole on my hand here? I used to have one.
There's a small one on the side here, and allows me to take a closer look and let you know that one is absolutely fine. But oftentimes this will assist us to know if we should do a biopsy in the office or if we should follow the mole. So it's a great tool.
It gives you, through the light, it will change color, or what does it do?
What it does, it gives you 10x magnification, so you can actually look down into the mole and see the different patterns and pigment changes. So that gives us much more information, let us know, is this a worrisome mole or is this something we can follow?
Interesting.
Very helpful, and most dermatologists are starting to use these a lot.
And this is something you said within the past 5 years in the U.S. anyway, it's taken hold a little bit more.
Yeah, I think it's come on strong in the last 5 years, and more dermatologists are using it. Very helpful. Oftentimes it can avoid an unnecessary painful biopsy. Sure. Other times it can direct you to do a biopsy.
We have 4-year-old and 7-year-old girls, Allie and Grace, and we're very vigilant about slathering them with the sunscreen. We do it to ourselves. Now, as kids, we didn't. But that's something that's important to do, even on a day that's somewhat overcast.
Absolutely. You really want a sunscreen SPF 15 or higher that also contains ultraviolet A protection. That's as important as the SPF factor. Put it on 30 minutes before you go out, because it takes 15 minutes for it to set up in the skin, and then reapply it frequently, hourly, and even more frequently if you're going to be actively perspiring or swimming. You can start using sunscreen in children at age 6 months, and before that doesn't mean they can be sun exposed, sun protect them. I'm also a big proponent of sun protective clothing, because once you put that on, that's protecting. There are a lot of good companies that make great stuff that you can wear in the summer, vented, lightweight, feels great.
That's right, and when we do that kind of little family treks we put that on, especially when we know we're going to be beachside for quite some time.
Yep, that's
very important. Kids don't
important.
seem to mind.
Good.
All right. Well, thanks, Doctor. Some great information, and thanks for telling us about the new tools of the trade.
Absolutely. Thanks for having me on.
Absolutely. Our pleasure. For more information on your moles or skin cancer, you can call the Crutchfield Dermatology Clinic at 651-209-3600 or log on to crutchfielddermatology.com.